Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with Brett Lanuti of Nocimed. Brett, thank you for joining us.
Thank you for having me.
So what was your background before joining Nocimed?
So my background, I've been in the med device space for approximately 25 years, primarily in spine, focused around innovative technology that hopefully provides better outcomes for patients. The most recent company I was with, which was Nocimed, I started there when it was a startup company in 2001. Now it's got a little close to a $2 billion market cap. And we were focused around innovative approaches for patients needing spine fusion. And in that process, started to really become intrigued with technologies that would also provide better outcomes, but not necessarily on the med device or implant side. And it turned out that NuVasive was an angel investor in Nocimed. And as they were moving to commercialization, they were looking for a new CEO. And the CEO of NuVasive at the time was supportive of me taking the role of Nocimed. And that's how I ended up here about a year and 10 months ago.
Well, that's great. So for the investors out there, what's your advice for those people investing in the MRI imaging space? What would you tell them to do first before they write that check?
I think it's what I would tell investors to do, which I think is broadly evident, which is obviously make sure that you're looking across the entire segment. And I think right now, investing in this particular segment is potentially limited around the companies that are currently available. So, for example, you have large imaging companies, Siemens, GE, Toshiba, Philips, are all providers of MRI, CT imaging technologies. And then from there, it gets a bit more limited in other ways to invest. One of the publicly traded companies that's available to invest is more on the imaging center side and is focusing a little bit now on AI, which is RadNet, and they are a publicly traded company. And there are a few others like that. So the space is limited relative to a lot of other technologies out there. Doesn't mean there's not opportunity, but it is maybe a limited base to invest in.
So how is the industry evolving? What new technologies or what direction do you see it taking?
I think the industry is evolving significantly, like many, around AI, machine learning for all imaging modalities, and trying to use that information through the AI learnings to better improve the information that ultimately better informs clinicians, which hopefully drives better outcomes for patients. And so I think the industry is definitely very focused around AI and machine learning.
Great. So how is the sector growing and what companies are engaging with it now? Are we going to see more AI companies coming into the space?
Yeah, I do think the industry is growing significantly. And I think we will see more and more people engaging with AI applications that will start to get into space. And again, it's unknown whether they will align with the larger imaging centers I mentioned earlier, or if they will try and go it alone and access data from those and then try and improve it at the imaging center level. But that is where I think the growth will come from in the future.
That's great. So what are the challenges in this space with regulatory or technical or marketing? What are the challenges the startup faces in running a business in there?
Yeah, I think there's probably two things going on. I think there's just overall concerns, or I should say headwinds in this market today around, and I'll focus right now around MRI imaging, because in certain segments, MRI is being challenged as based on its accuracy for certain applications. Chronic back pain actually happens to be one of them. And most recently, a group called Covera Health did a large body of analytic work around Walmart patients that were receiving diagnostic care and then went back and looked at the outcomes after receiving that care. And in that analysis, which they presented, it unfortunately put MRI a little bit on the hot seat relative to chronic back pain patients because, for example, they had one patient that was a 63-year-old male who had 10 MRIs and ultimately received 10 different diagnoses. And so I think there's some headwind specific to MRI right now in making sure that it is prescribed for the appropriate needs. So I think that's some of the challenges in the marketplace today. I think as a startup company, Nocimed has been in this space since 2008 as they've worked through the licensing of the technology based on foundational science from UC San Francisco. It is still getting the confidence with the clinicians that there is now finally a quantitative technology that can better support the images that they're receiving for MRI. So it becomes more of an adjunctive tool for them to become more accurate in their assessment of MRI issues for patients suffering from back pain. That makes sense.
Yeah. So tell us more about Nocimed and how do they fit into the landscape? It seems like they have a better approach to it, but what else can you tell us?
So Nocimed, I think, fits into the landscape for a couple of reasons. One, it is a SaaS software technology, so it really doesn't require upfront capital expenditure either at the hospital or private imaging center. So there's not a lot of upfront cost that the imaging centers need to incur because, again, it's a cloud software that uses identification of biomarkers associated with pain in lumbar spine, and it creates a report that's very easy to interpret that, again, provides both radiologists as well as clinicians more informed information.
Well, great. Well, in the last few minutes that we have here, what else should we cover that we haven't?
I think we've covered quite a bit. I think there's a tremendous opportunity with this technology and even other technologies, hopefully, that will come down in the future that are really going to help these chronic back pain patients. There's over 25 million people a year that have back pain. It's the number one reason people go to see their general practitioner. And again, they really struggle because there is a lack of definitive information which help inform where their pain's coming from, which is partly driving some of the opioid crisis because the number 2 consumer of opioids in the world today are chronic back pain patients. And so I think it's important that the work of Nocimed and potentially others in the future continue to find more quantitative ways to help these patients get an informed decision much sooner than they do today.
Well, that sounds great. So how best for listeners to get back in touch with you?
So I think if they are interested, they should go to our website at www.nocimed.com. They can contact me via email at blanuti@nocimed.com.
Great. Well, we'll put those in the show notes and invite people to follow up with you through those. Thank you for joining us today and hope to have you back for a follow-up soon.
Great. We really appreciate it. And again, we are in the process of starting to look to engage in what we hope to be our final round of financing, if there's interest at that level as well.
That's great.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.